Hi everyone, I'm Dr. Bianca Rojas Cruz from Reflection Psychology. I'm a provisional psychologist there, and today I thought we'd have a talk about the topic of depression. So depression is quite a prevalent illness in Australia. About 1 in 5 people experience a depressive illness in their lifetime. Characterised by periods of ongoing low mood, chronic feelings of emptiness, and these usually last for, they need to last for at least 2 weeks to get the diagnosis. There's lots of different types of depression, so things like depression with psychotic features, postnatal depression, melancholic depression. So that means that people's experience of depression can look very different. Someone could withdraw and isolate themselves. The person next to them gets up and goes to work and puts on a bit of a facade each day. So the experience can be quite different for everyone. For most people, it's going to be biological in nature, which means that things like medication, antidepressants will be part of their ongoing treatment. And then there's the psychotherapy as well. So things like cognitive behaviour therapy, where we would look at, challenging some of the cognitive distortions that go along with depression. With depression, there's usually that negative skew or filter for the way that we look at the world. So we might look at creating some more balanced, neutral statements rather than, seeing things with that negative filter. So rather than having the thought that, I'm useless, for example, not changing that to being, I'm amazing, but being able to say, there are some things that I find challenging and other things that I'm pretty good at. So that's what I mean by a more balanced and neutral statement. And we challenge some of the cognitive distortions, things like catastrophizing things to worst case scenario, that real rigid black and white thinking of things are either good or bad or right or wrong, and mind reading, assuming intent behind the behaviours of other people, and then acting on those as though it was a fact rather than an assumption. The other thing is the behavioural component, so that would be things like skills training, learning some mindfulness skills and grounding skills, things like guided meditations, progressive muscle relaxations, things that bring us back to that present moment awareness. Because in depression, you're probably spending a lot of time trying to hang out in the past. With anxiety, it's a lot of time trying to spend in the future or control the future. So we really want to be able to bring ourselves back to this present moment and live in the present and have that awareness rather than spending that time in the past. So these mindfulness and grounding skills can help us to do that. Things like, self-soothing as well, using distraction appropriately would also go on board with skills training. Things like behaviour activation are important as well. So targeting areas of relaxation, pleasure, mastery and achievement. In depression, it is important that you learn skills how to quiet your mind and learn how to relax and create that sense of calm, and take that time out to do those things is very important in managing the illness and in your recovery. With pleasure, this one can be quite tricky because, like I said, with ongoing low mood or chronic feelings of emptiness, it is going to be quite a challenge to experience pleasure. And that loss of pleasure is called anhedonia. If I can give you an analogy, though, if you think of filling a glass of water and the water spilling over the top, and that being when pleasure returns, what we want to do is be persistent and create opportunities for that pleasure to return off its own accord, because you're still making progress when you're a quarter of a way, and then halfway, and then 3/4 of a way. Eventually that water spills over again. So to start with, you want to remove the emotional goal. So by that I mean not doing things for the sake of feeling good about it, but to do things to tick them off that they're done and that we've achieved something, even if you don't necessarily feel good about it to start with, because we know that motivation follows action and we're creating opportunities for that pleasure to return. So using skills like opposite action could be helpful as well. The action urge could be to withdraw or isolate ourselves, but we want to commit to doing the opposite of that to create those opportunities for pleasure to return as well. The other thing to think about is your support network. So obviously psychiatry, managing your medication, psychology, for psychotherapy, but also your support networks in your family, your friends and your community, because hopefully those professional supports won't be there long term, but family and community will be. So it's important that you do have someone to be open and transparent with about how you're really feeling, rather than, you know, putting that facade on and pretending like you're okay when you're not. And to utilize those supports to help with motivation and to help get engaged in community again. Obviously, it's that balance between making time for relaxation and knowing when you do need to take time out to quiet your mind, but also be open to getting that support to get out and about and engage in things again. So that's pleasure as well. And things for mastery and achievement. So to have a sense of purpose, to have things that you can tick off that are small, realistic, achievable goals that you can achieve daily. You know, start from where you're at. Perhaps you have functioned well at a different time of your life, but you've got to work from where you're at right now and take those steps to get back to that level of functioning that you would like to get back to. The other thing to think about, you know, with your supports as well, is refrain from making big life decisions when you're in the midst of a depressive episode. So like I said, you know, with depression, you can have that negative filter, that negative skew, and those chronic feelings of emptiness. So that can often be confused with, you know, perhaps not having feelings for someone anymore, rather than seeing it as a symptom of the illness. So that's why we want to refrain from doing things like, you know, moving interstate, or, you know, quitting your job, ending relationships, those sort of things, until you've had some time to work on your recovery, because, you know, like I said, that those symptoms could distort what you're really feeling, or what you'd really like to do. So it's important to prioritize recovery to start with. So to recap, depression, pretty prevalent illness in Australia. 1 in 5 people experience it. Lots of different types of depression. You know, you want to utilize medication where necessary, engage in therapy, cognitive behavior therapy, challenge those thoughts, do some skills training, create opportunities for pleasure to return off its own and maintain activation, things for mastery, achievement, pleasure and relaxation. Make sure you've got appropriate supports. You know, there might be that temptation to push people away, but in terms of making progress in recovery, you know, it is important to be able to reach out, to engage with those people around you, and be open to receiving that support as well, even though it might be tempting to push people away, because we can confuse that chronic feeling of emptiness for, you know, not having feelings or wanting to push people away. There's got to be that balance between, you know, activation and things for relaxation, quieting your mind, using skills like mindfulness to bring us back to that present moment awareness, and you know, keeping us here in the here and now, rather than trying to hang out in the past or the future. So if you don't have many supports, you know, think about opportunities to increase that support network in your community, with friends and family, you know, engaging with organisations, NGOs, your local community centre, things like that, and think about seeing a professional for some support for medication management and therapy as well.